This webinar is the third in the three-part series highlighting the importance of using Fraser Health-approved communication tools, focusing on the effectiveness of using a centralized communication network across all care areas within Fraser Health. Designed to incorporate a summary of the previous two webinars, on completion of this final webinar in the series, it is intended you will see how these Fraser Health-approved communication tools are designed to work together to support consistently accountable, efficient, and effective patient-centered communication. In 2017, Fraser Health designed a theoretically based framework to support a more consistent and accountable communication structure for acute care teams, focusing on the individual needs of the patient and their family or support system. This 5-goal focus question framework, used during structured team rounds in acute care, is designed to clearly establish current patient clinical and functional status and goal setting, including discharge destination, prior to establishing priorities or tasks to be completed prior to the next scheduled team meeting. Following discussion of these 4 preceding questions, the care team should have a more informed estimate of the patient's discharge date. Standardizing interdisciplinary team rounds has also helped to support more seamless care transitions by providing an opportunity for enhanced care coordination, improved communication among experts on the patient's care team, and addressing priorities and setting care team-informed timelines to support a sustainable and proactive transition, including information received from community partners now also accessing the tool. Other benefits are associated with minimizing the delays caused by multiple back-and-forth phone calls, in addition to no longer requiring access to multiple sources for information. This 5-goal focus question framework was developed within the pre-existing information sharing technology called iTracker, enabling a centralized source for 24/7 care team progress updates, interdisciplinary care team accountability for decision-making prior to and during structured team meetings, and a direct link to patient information across all care areas within Fraser Health. To further support seamless transitions and avoid potential patient harm, all acute care patient care coordinators and care management coordinators can now access patient information in iTracker prior to patient transfer to their site. Proactive referrals and engagement of community health nurses as the single point of contact into specialized community services programs now access the iTracker communication tool to enable healthcare system navigation and seamless care coordination for seniors or adults with complex medical conditions as they transition across all care areas within Fraser Health. As a direct link to local divisions' primary care practitioners, community health nurses can also promote timely engagement of primary care practitioners following patient discharge back into their communities. To access iTracker in the Structured Rounds template, just click on the radio button on the Pulse homepage. The page will default to the patient census for a specific site. Select the site and location for your patient population, then click anywhere in the unit census line for each patient to open their Structured Rounds template. There is also an advanced search option in the left menu, where care teams can search for patients by name, PHN, or Meditech account number as the main identifier. If you don't see the advanced search option in your left menu, please send an email to the Systems Operations Support Team using the Contact Us link at the top right corner of the iTracker tool. Please note, if a patient is repatriating from another acute care site, they will have a new account number for every new admission. To return to the patient list, click on the patient list link on the left side of the screen and you will return to the patient census information to choose the site and location for your patient. By default, the iTracker will always open to the Structured Rounds tab. We will now review the patient-specific elements, starting with the banner and moving into the 5-goal focus question framework to help the care team define priorities and estimated discharge date based on the patient's current state. The long stay predictor, or LSP, serves as an early warning sign the patient may be at risk for a prolonged length of stay. This indicator should trigger the need for an increased focus on collaborative interventions by the entire care team, including proactive referrals to other experts on the team, engagement of community partnerships, and patients and their families to support ongoing decision-making. This indicator is automatically generated using an artificial intelligence algorithm based on information available in Meditech at the time of admission. The LSP tool has been validated with improved accuracy of 82%. This means it can identify 82% of long-stay patients accurately compared to 44% clinician accuracy. Readmissions to hospital are common, costly, and often preventable. Fraser Health has adopted an easy-to-use and validated index called the LACE scoring system to quantify the risk of readmission or death after discharge from hospital and help clinicians, from the time of patient admission to hospital, identify patients who might benefit from more intensive post-discharge care. The tool has been extensively studied in the literature and has been peer-reviewed to be a reliable 30-day readmission risk predictor. A moderate risk score of 9 to 15 to high risk score of greater than 16 noted on admission helps to provide patient-centered evidence of potentially avoidable readmission risk. The risk score should trigger proactive engagement of community partnerships and an active focus on the potential need for additional resource allocation, rather than waiting until the patient is medically stable to initiate these conversations. In a recent Canadian study seeking to derive and validate an index to predict the risk of death and unplanned readmission within 30 days following discharge from hospital to community, their use of the LACE scoring index demonstrated a 1-point increase in LACE score increased the odds of unplanned readmission by 18%, and this single point increase in score also increased the odds of early death by 29%. Shifting focus to the 5-goal focus question framework. For question 1, what is the patient's medical, surgical, mental health status? This is where patient care teams will document current clinical information relevant to care team decision-making. It is important to list active clinical concerns and responses to treatment, test results, or possibly consultant inputs to support transition planning. With new patient admissions to the unit, what is clinically relevant to the team to help inform prioritize actions today? It is important to focus only on the current clinical information, keeping in mind to delete outdated communication that is already captured in the legal record. To add a new entry, just click on the green button on the bottom right of each question in the template. It is also possible to update an existing entry by just clicking into the text box to either change the narrative or add to it. If there is no change in clinical status, for example, patients occupying an acute care bed and waiting for a service currently not available in the community, then the PCC or designate leading rounds will move on to the next question in the 5-goal focus question framework. It is not necessary to enter information indicating no change in patient status. Current clinical state is evident from the last entry or update. Question 2. What is the patient's functional status? Determining patient's baseline or prior to hospital functioning helps to inform discharge goal setting. This will help to determine what services are needed to either support patient baseline or potentially establish a new baseline for patient transition out of an acute care setting where patients will return to their community to continue their recovery and address their healthcare needs. It may also be helpful to include baseline Braden or CAM scores to support decision-making and transition planning. The elements highlighted in the columns under question 2 help to prompt for current functional status based on your daily assessment. Individual experts on the care team updating on their specific elements applicable to patients' current state helps to proactively identify and discuss potential barriers or challenges that need to be resolved to support a seamless and sustainable transition out of the acute care setting. This may also include psychosocial or cultural safety concerns that can be difficult conversations to initiate and may need to be considered by the entire care team when developing a sustainable discharge plan. Question 3. What is the discharge goal? Consistently focusing on the discharge goal prior to establishing daily priorities will help to promote efficiencies in patient-centered service delivery. Medical goals are significantly important because many of our older adults are experiencing multiple comorbidities and may have established goals that conflict with the care team's perspective. Another recently added feature is further explanation of the pre-existing other box as intended to be where care providers can document facilities not listed or found in the drop-down box above. We have also added a field to prompt for community health professional involvement. This will assist care teams attempting to consistently and effectively connect with community partners to support proactive care transitions. The team should also be reviewing the discharge destination daily and ensuring proactive interventions are being implemented to address discharge needs. Under the comment box, current questions or concerns may have been documented by other care providers prior to rounds, including the primary nurse, following his or her collaborative review of the bedside board with their patient. The comment box is also helpful to track potential challenges or details required to support quality patient care delivery and achieve estimated timelines for transition planning. Question 4. What is today's medical, surgical, functional plan to reach the discharge goal? Now that the care team has reviewed the previous 3 questions, they are more informed on current priorities and actions needed and also have the ability to track previously noted tasks and update timelines. It is important to also clearly indicate who the respective task is assigned to in the free text column, including current status for this task. Using this example, the team may have assigned a task to a care team member unable to prioritize rounds, and the status is only assigned until the task can be reviewed. There may also be communication updates provided by other members of the team. The contact person for follow-up may also be indicated here, and the rationale for contact included in the associated comments free text box. Under the resource column in question 4, the drop-down will indicate who or what is needed to be arranged today to support a sustainable transition plan. When indicating the associated tasks for completion, comments, and assigned to information, keep in mind this template is designed to support the fluid narrative. As a worksheet, it is designed to reflect care team decision-making, including necessary changes based on details that are applicable to daily changes in patient health status. Focusing on timelines, they are only intended to support the consistent narrative and help to establish discharge readiness for the entire care team, including patients and their families. It is also helpful to clearly explain the rationale for the resource and associated task, especially if the assigned member of the care team is not able to prioritize their attendance in structured team rounds. This may be helpful for allied health professionals covering multiple units and unable to prioritize their attendance in the meeting, or the community health nurse reviewing the template to support existing home health clients or new referrals. Remember to also delete outdated information or communication no longer requiring review by the care team by just clicking the box next to the entry that can be deleted and then clicking on the trash can in the bottom right corner of each question. It is also helpful to use the status elements to log canceled procedures, in addition to monitoring pending or completed tasks that need to be tracked. Just remember, not all tasks need to be tracked as completed, as these interventions are also documented in the legal record. If the communication is required to support communication between community resources and acute care, this communication can be tracked either under status here in question 4 or copied into the comment section of question 3 to support tracking once completed. Another important feature on the template is the Show All commentary. Without checking this box, by default, only the last 3 entries will be displayed. Although it is not recommended to maintain historical communication, there are times when this is necessary to help build the narrative and inform key decision-making. The most recent 3 entries can be expanded to include all free text fields by checking this box each time the team accesses the template. Recognizing it is not always clear what needs to be entered into iTracker to support priority setting, I will use an example of Mr. Doe, a 62-year-old male admitted to the medicine unit for uncontrolled diabetes associated with poorly controlled insulin management and poor diet choices. This is Mr. Doe's 3rd admission in 6 months, with a LACE score of 15, associated with ongoing diabetes management concerns, and the care team is actively engaged in planning for a sustainable discharge. The MRP informs the care team during today's structured rounds Mr. Doe is medically stable to go home tomorrow because his blood sugars are appearing to be well controlled with his insulin management. The latest blood sugar results are documented in question 1. Mr. Doe's registered dietitian has been prioritizing development of a sustainable diabetic management plan with Mr. Doe and his daughter that also meets his financial budget. Unable to attend rounds today, she has documented in question 2 that she has reviewed the updated diet plan with Mr. Doe and his daughter. This information is added to question 4 to ensure Mr. Doe's daughter is aware to pick up education material left for her at Mr. Doe's bedside. The registered dietitian has also updated Mr. Doe's bedside board with this information. The pharmacist feels Mr. Doe is going to be more compliant with his insulin management if his community pharmacy provides preloaded insulin syringes to enable him to self-manage his insulin. The community health nurse has confirmed with Mr. Doe's community pharmacy they can deliver preloaded insulin syringes. However, Mr. Doe's daughter will be required to notify the pharmacy when Mr. Doe has returned home. Once this task was completed to arrange for home delivery, the update is now tracked in the comments section in question 3 for care team awareness. The task added to question 4 today is for the PCC to confirm with Mr. Doe's daughter following rounds that she is aware to notify the community pharmacy following discharge tomorrow. Mr. Doe's care team have been doing a great job using the iTracker communication tool to track their assigned tasks and their updates to the discharge plan. The primary nurse will discuss with Mr. Doe that he will be going home tomorrow and update his bedside board with tomorrow's date for when he is going home. When Mr. Doe's daughter comes in, she will see these updates, and because she has been actively involved in decision-making, it is anticipated this will not be a concern. Mr. Doe will also be attending the local diabetic clinic for ongoing education and support with his diabetes 1 day per week. This has also been documented in the comment section in question 3 now that this task has been arranged and now complete. Now that the care team has reviewed current state and established priorities, they are better able to determine Mr. Doe's estimated discharge date, or EDD. EDD predicts the likely date a patient will transition out of the acute care setting. Clear communication of the EDD helps to determine discharge readiness for both patients and their families and establish clear timelines for availability of required resources. It is not uncommon for physicians and other members of the patient's care team to experience some concern predicting the patient's discharge date, especially on admission, because they may not have all the information they need. In Fraser Health, we have made this decision-making easier by using artificial intelligence to predict this date on admission for all inpatients. The data is determined by historical patient information and both national and site-based averages for length of stay. The date generated will not replace the professional judgment and daily assessments conducted by the care team. It is only intended to be used as a guide to inform this important decision-making. The EDD is a direct reflection of how well the interdisciplinary team is able to match their patient service needs. Early determination of an EDD helps to ensure all concerns identified in the patient's plan of care are addressed within a medical model for quality patient care delivery. Please also remember to update the reasons for EDD change on the patient's bedside Understanding My Stay board as part of a collaborative conversation with your patient and/or their family. The goal is to meet expected length of stay within this model and avoid, whenever possible, an alternate service designation or ALC code representing service mismatch, and the needs of the patient would be more appropriately addressed in a lower acuity environment. Assigning and updating ALC designations is the responsibility of the patient's entire interdisciplinary care team based on a collaborative assessment of most appropriate service to meet patients' needs. The only exception to this mandatory field is when a patient is actively dying and an estimated discharge date is not required. Please always remember to update the reason for EDD change. Using the example of ALC designation, this data is then pulled from iTracker structured rounds template to inform the number of ALC patients in Fraser Health and updated regularly in the bed visualization dashboard, also known as Archie. Performance metrics from question 4 and 5 are pulled from the structured rounds template into Archie. If the template is not currently maintained, there is coding inaccuracy and potential for delays in acquiring additional resources determined by decision makers monitoring the dashboard. To provide further guidance, the iTracker platform was also recently updated to support a more in-depth and standardized analysis of patient complexity by adding a complex patient screening grid. To access the template, you will see there is a tab next to the Structured Rounds tab at the top of the iTracker screen. By opening this tab, you will see the complex patient screening criteria broken down by headers. Complex criteria was developed because LSP and LACE do not capture the majority of complex patient profiles, including functional decline, lack of supports, family or team conflict, and housing. This framework was developed based on evidence to support the complex patient impact on prolonged length of stay that may result in service mismatch or ALC coding when a patient is no longer requiring a high acuity service and would benefit from a more appropriate setting for their care needs. Care teams will now have a standardized framework to define their complex patient population and support their professional judgment. Once this information is populated, the checkbox, located in the banner of the structured rounds template, will auto-populate to indicate to the care team there are specific indicators within the complex patient screening tab to help qualify patient complexity. This checkbox is no longer manually controlled, which means without populating the complex patient screening tab, the checkbox cannot be updated. In the unlikely event the patient becomes no longer complex, by clearing these fields in the Complex Patient Screening tab, the checkbox will also clear in the Structured Rounds template. In addition to being a centralized communication network across all care areas within Fraser Health, iTracker also has the capacity to print reports that can be used when technology is not available, in addition to pulling from other Meditech resources to promote greater efficiency. There is also an ability to run reports, for example, readmission rates, site status, and surgeries to support timely follow-up. To access printable reports, under the Reports link on the left of your screen, you will see there is an option to print a customized report in iTracker. You can select all units or specifically focus on selecting individual patient units for a report. The report can also be sorted by the number of days, although please keep in mind by selecting all, there may be extensive commentary to review in the report if care teams have not been deleting entries that are no longer relevant to team discussion. Prior to printing and using the all sorting function, I would suggest reviewing the worksheet to ensure the communication to be reviewed is relevant to current team discussion. The printed report can also be filtered by either all or only select questions. A report can also be filtered by long stay predictor and LACE score. When the Paris Duty Desk shows new referrals or existing home health clients admitted to acute care, the Home Health Client Hospital Journey Report can be used to verify client location anywhere within Fraser Health acute care settings. Teams in the community have found this report helpful to highlight acute care admission information for their clients. Our partners in systems optimization have also recently updated this report to include a new PHN column to assist Paris users locating their clients in acute care. Please note that clients admitted to acute care sites outside of Fraser Health Authority are not visible on iTracker. In summary, the Structured Rounds template provides consistent and accountable communication both during and prior to structured rounds. The team is required to listen and engage in priority setting based on their professional expertise, be familiar with roles and responsibilities within the team, and be an active participant in the collaboration and coordination of quality patient care delivery. The template also provides a broader scope for team engagement across all care areas and key stakeholders, creating the opportunity for key team members covering multiple care areas on a given day to provide their input prior to team rounding if they are unable to prioritize their attendance. The iTracker template also enables community partners to access current patient information, promoting discharge readiness and seamless transitions. By maintaining the requirement and wait times for associated resources will also help to further define resources needed within the organization. This concludes the webinar series highlighting the importance of using these Fraser Health recommended communication tools and how they can be applied to your care areas. Please remember to access additional resources located on our Quality and Access Pulse page, including the Regional Archie Super Users Toolkit. Teams are also encouraged to review the e-learning module located on the Learning Hub. As a regional support, Team Access is committed to improving both the patient and provider experience by consolidating and leveraging existing strategies and strengthening communication and accountabilities within healthcare teams, patients, and their families. We invite you to get in touch with either Sally Ross, Regional Clinical Nurse Educator, leading this education, or other members of the team using the Team Access email. If you are experiencing technical concerns with the template, our colleagues in systems optimization are also available to provide support.